Hello, future doctors, and welcome back to our channel. Today, we are diving in some challenging and MDCAT MCQs to sharpen your knowledge. Let's get started. So, the first MCQ is which of these makes the third line of defense? A. Neutrophils, B. Macrophages, C. Skin, and D. Lymphocytes. So, the correct option is D. Lymphocytes. The next MCQ is antibodies consist of A. 1 chain, B. 2 chain, C. 3 chain, and D. 4 chain. So the correct option is D. 4 chain. The next MCQ is senile RBC breakdown occur mainly in A. Bone marrow, B. Liver, C. Lymph nodes, and D. Spleen. So the correct option is D. Spleen. The next MCQ is all of the given veins carry deoxygenated blood except A. Superior vena cava, B. Hepatic vein, C. Inferior vena cava, and D. Pulmonary vein. So the correct option is D. Pulmonary vein. The next MCQ is joint present between the proximal end of radius and ulna with humerus is A. Pivot, B. Hinge joint, C. Ball and socket joint, and D. Synovial joint. So the correct option is B. Hinge joint. The next MCQ is elastin is a protein that can be found in A. Bones, B. Ligaments, C. Tendons, and D. Capillaries. So the correct option is B. Capillary ligaments. The next MCQ is the one which causes contraction of the wall of the uterus during and after birth. A. ADH, B. Oxytocin, C. MCH, and D. Progesterone. So the correct option is B. Oxytocin. The next MCQ is the spinny look of neurons is due to their A. Myelin sheet, B. Axon, C. Dendron, and D. Dendrites. So the correct option is D. Dendrites. The next MCQ is all of the following are important function of neuroglia in CNS except A. Protection of neurons, B. Speed of impulse conduction, C. Neuronal division, and D. Nutrition of neurons. So the correct option is C. Neuronal division. The next MCQ is uterus gains maximum thickness during A. Secretory phase, B. Fully Froli Ferratio phase, C. Menstrual phase, and ovulatory phase. So the correct option is A. Secretory phase. The next MCQ is oogenesis and human female start A. 80 puberty, B. Before puberty, C. Before birth, and D. After puberty. So the correct option is C. Before birth. The next MCQ is hemophilia can be the result of A. Reduction of blood clotting factors, B. Malfunctioning of blood clotting factors, C. Complete absence of blood clotting factor, and D. All A, B, and C. So the correct option is D. All A, B, and C. The next MCQ is multiple alleles are the alleles that are always A, more than 1, B, more than 3, C, more than 2, and D, more than 4. So the correct option is C, more than 2. The next MCQ is albinism is a dash trait. A. Autosomal dominant, B. Sex-linked dominant, C. Autosomal recessive, and D. Sex-linked recessive. So the correct option is C. Autosomal recessive. The next MCQ is which of the following traits pass in zigzag fashion from parents to offspring? A. X-linked traits, B. Y-linked traits, C. Six influence traits, and D. Six unlimited traits. So the correct option is A. X-linked traits. Thanks for joining me. I hope these NMDCAT MCQs help you sharpen your knowledge. Keep studying and stay tuned for more practice questions. Thank you and Allah Hafiz.